Good morning and good afternoon, everyone. I'm Dr. Michael Jones, and we're here for how to make your medical exercise training practice referral ready in 30 days. And this is day number 10. So we're the third of the way there. So today we're going to talk about the idea of standardize your MET assessments. Now, this becomes very important. I know many of you have completed your medical exercise specialist certification or other medical exercise or post-rehab based certifications. But one of the key things you learn, at least in our medical exercise specialists, we start talking about the idea of doing assessments and also performing components in the assessments and assessment procedures that the doctors, therapists, and chiropractors will understand, and starting to use their nomenclature, their terminology, and their procedures to assess to some degree, not to diagnose, but just to get an idea of a baseline of where the client is. Please, if you would, the fitness assessments that you are used to doing as a personal trainer are not going to hack it now in the medical community. They want more specifics that are correlated and designed to assess function, and function can include range of motion, strength, balance, any number of things. They want assessment procedures that they know specifically are looking at those particular areas. So, as a medical exercise professional, and you're looking now to get referrals from the medical community, not only do you have to communicate and an ongoing, appropriate, and timely communication, but you have to use assessment guidelines or assessment procedures that the medical community understands. So that's what we're going to talk about. We're going to take about 15 to 20 minutes of your time. So one thing I have to always review here is your scope of practice as a medical exercise specialist or medical exercise professional. MET assessments, vitally important. That's what we're talking about today. And please, with these MET assessments, understand the assessment is not designed necessarily for you. It's designed for you to get a baseline of the client's current functional status, utilizing components that the medical community, insurance carriers, other trainers will understand. So you have to use a language that works for everyone. I've had some of our MESs after they've graduated, they said, well, I made up my own assessment utilizing my own assessment procedures and my own guidelines. Well, that's great, but it doesn't translate to everybody else. Also, with this scope of practice, it includes cardiovascular training, flexibility training, strength training, functional conditioning, balance training, lifestyle education, aquatic training, and also stabilization training. So please make sure you stay in your lane. Now, if you're a licensed massage therapist, you're a licensed physical therapy assistant, you're a licensed occupational therapist, physical therapist, chiropractor, then of course, use the skills that you have that are within your scope of practice. But for the medical exercise professional, this is your scope of practice, which allows us now to talk real quickly. And today in particular, we've talked about our manual, Cracking the Code. This is designed for the medical exercise professional that wants to deal with insurance carriers. We take you step by step through everything you need. And then also our advanced medical exercise specialist manual. We put these together into a bundle, a digital bundle. So if you want to order both, it's $199. Actually, I think the manuals themselves far exceed individually $199, but we bundle them together into a special price, which will be a digital download. You'll be able to download both manuals immediately. Go over to crackingthecode.net to do that. And with that, we're going to talk a little bit more about that advanced medical exercise specialist manual, but let's go ahead and get started. Again, we're talking about the standardizing your MET assessments. So the first thing, when we look at this idea of utilizing a standardized assessment process, when I say standardized, something that the medical community also understands, the components you're using, the terminology you're using, the values that you're actually using as far as your baselines, and also showing progress, it gives you credibility with the medical community. Folks, in many instances, the medical professional, doesn't understand some of the terminology that we use in fitness. So we have to talk on at their frequency, utilizing their terms and their language and their terminology. So one of the things you'll find as you standardize your MET assessment process and align it more with what the medical community does, not with the idea of looking at diagnosing, but just assessing to get a baseline, you're going to find this will give you a lot of credibility in the medical community. Number two, it will allow you to track and show progress. I'll give you an example, checking blood pressure or checking range of motion or checking strength. Medical professionals clearly understand those values, and they certainly see how those values will either improve or they may diminish or deteriorate. So you're able to track and show progress easily and in a manner that the medical community obviously immediately understands. Next with this, you want to communicate in medical speak. Now, medical speak, and I use this term loosely, medical speak means how the doctor, therapist, or chiropractor communicate and how they speak. If you had the opportunity to ever work in a medical clinic, a physical therapy setting or chiropractic setting, or maybe a doctor's office or a hospital setting or nursing home setting, you understand that there is a terminology there. And also, not only is there a terminology, there's a process. Now, it's kind of interesting. When you look at the legal field, lawyers, legal assistants, judges, other individuals that are in the legal field, they all talk with the same legal speak. You go over to architecture and engineering, it's the same thing there. The same thing holds true for the medical community and healthcare. They all use the same medical speak. But now, for you as a fitness professional, you communicate with other personal trainers and you're using fitness speak. So, one of the key things here is now, as we start communicating with the medical community, we have to talk to them in the language that they understand. So, this will help you actually with the idea of medical speak, utilizing assessment procedures that produce outcomes and values and measures that now you'll use that are aligned with the medical community's ability to communicate and they understand. And most importantly, it also allows you to improve program design and outcomes. So if you have standardized assessment guidelines you're using, it now allows you to say, okay, this client isn't showing much improvement in certain areas. And as a result of that, it now allows you to tailor the program or modify the program as necessary, as well as still reporting the outcomes to the doctor, therapist, and chiropractor. So having this standardized assessment process that you're going to use on an ongoing basis, depending upon the client's condition, is vitally important. Now, there are 5 assessment categories that are important for you to understand as a medical exercise professional. And when I say 5 assessment categories, 5 assessment areas in the management of the medical exercise training client that become important. Obviously, first one, range of motion flexibility. Number 2, muscle strength. Number 3, gait and balance. Number 4, function. And number 5, pain. Now, let me mention one thing about pain. The tendency I find for most new medical exercise professionals is they want to manage a client's pain. Now, let me make sure you don't get trapped in something here. If you ever have to deal with an insurance carrier down the road and you're always focused on the idea of talking about pain, insurance carriers are going to cut you off. The reason is this. Let's say you take a spike and you drive it into my hand. Okay. Next, I think I saw Nikki on the join us on the call. Now, Nikki is one of our medical exercise specialists. He's also a massage therapist in Florida. And you take that same spike and you drive it into Nikki's hand. Well, guess what? I go crazy. I'm yelling and screaming. And Nikki just sits there and just says, Dr. Mike, what's going on? What's wrong? Here's the deal, folks. Measuring pain between clients, you can't do it. So please, if you would, remember this. Pain is subjective. Don't get caught up in the idea you're measuring pain. You're always focused on the client's pain. And we also know this from insurance carriers. They eventually get to the point they don't want to hear about the pain. They only want to hear about function. So if you look here, the first 4 items here on this list are vitally important: range of motion flexibility, muscle strength, balance and gait, and function. Now use pain as that 5th component, but don't focus on it. And I wanted to mention that because I know many of you always talk about the client's pain. I'm going to help them get out of pain. Folks, pain is very subjective. It is very difficult to measure. And the one thing I recommend, if you use pain as one of your assessment categories, that you use it on a 1 to 10 pain scale, with 10 being the greatest amount of pain the client has had with that particular condition they're coming in for, and 1 being the least amount of pain. So use a pain scale. And with that, let's talk about functional outcome measures. Now, in this presentation, we're not here to tell you what assessment procedures to use. We're here to give you an idea of make sure you standardize it. So these are functional outcome measures. These measures are universally understood by doctors, therapists, chiropractors, insurance carriers, nurses, every medical specialty, as means of determining how well the client is doing with regard to their medical condition, as well as their homeostasis. So glycosylated hemoglobin, obviously, this is a Bell standard or the standard of measurement for the diabetic client. Blood pressure, is important, obviously, for the client that has hypertension. Blood glucose. Now, this is where we're just simply measuring the blood glucose on a daily basis. This is also important for the diabetic client. Let me go back to number one. Glycosylated hemoglobin is the standard that we use. Normally, that test is done every 90 to 180 days. That gives us an idea of the client's A1C level, which is really the standard measurement to determine how well the management process, whether it's medication or medical treatment or exercise, is really working. So, as I said, blood pressure, blood glucose. Number four, anthropometric measures, just simply body fat measures. Number five, muscle strength. Number six, functional assessment scales. These are going to become more important for you, the medical exercise professional, and I recommend that you get that advanced medical exercise specialist manual because we go into depth into functional assessment scales. And these scales allow you to look at the client's functional capacity and take snapshots of that capacity, grade the client's ability to perform activities, which now look at their function. That gives you a point value. And then periodically, every 30 to 45 days, you reassess the client utilizing the appropriate functional assessment scale. And that way we can see if the client is making progress. That's a standardized measurement that the medical community understands. Physicians, therapists, chiropractors, and insurance carriers. Number seven, range of motion. Number eight, heart rate. Number nine, cholesterol levels. Number 10, the pain scale. And again, this is a 1 to 10 pain scale that we try to use as objectively as we can. And 1 being the least amount of pain, 10 being the greatest amount of pain. Number 11, body mass index. And I know for a lot of you in the fitness industry, when you hear the word BMI or the phrase BMI, you go crazy. Folks, in the medical community, BMI is still used as a measurement that is important in determining certain procedures or surgical interventions. And with that, BMI is still something used in the medical community. And number 12, bone density. I know some of you work with clients that have osteoporosis or osteopenic. The exercise programs that you're giving these clients, which introduce some degree of weight bearing, we should see improvements in bone density. So when we look at these functional outcome measures, some of these are testing procedures that must be ordered by the physician. Others of these are procedures or assessments that you can do yourself, but these are all functional outcome measures that are vitally important in telling us the effectiveness of the exercise program, which takes us now to functional assessment scales. Now, these scales we teach in our medical exercise specialists. We go into greater detail in our advanced medical exercise specialists, and we feel these functional assessment scales will become the standard assessment as we move forward over the next 2 decades. And we start to see insurance carriers are paying for more and more medical exercise training services. These scales include the Functional Status Index, which is a simple scale that allows you to look at the client's functional capability in a number of different areas, particularly areas that are based on activities of daily living. Number 2, the Tonetti Balance and Gait Scale. We utilize that, and there are a number of others out there, but we find that this one is the one that's most often used by neurologists, physical therapists, as well as orthopedic surgeons and insurance carriers. Number 3, and number 4, the cervical and lumbar oswestry scales. These are used to determine the functional capabilities of clients with cervical disorders or lumbar disorders. Then we also have a lumbar stability scale. This scale is one that I learned at the San Francisco Spine Institute, and it's used universally by medical professionals that see lumbar clients on an ongoing basis, or I should say they focus on those. Clients that have disc herniations, have undergone surgical procedures, degenerative joint disease, or other lumbar issues. This scale, actually, and there are multiple components with the scale, allow you now to get an idea of lumbar stability, especially in those individuals that have chronic conditions or have undergone surgical procedures. Number 6, the Harris Hip Scale. This one becomes important, folks, because so many of our clients now are having total hip replacements. It allows us to look at the client's functional capability focused on their hip. Number 7, the Shoulder Strength Scale for clients who've had rotator cuff tears, impingement syndrome. This scale allows us to get an idea of what the client's capability is as far as shoulder function. The Lisholm scale, number 8, is for clients with knee disorders. This one works for clients who have had total knee replacements, ACL reconstruction, meniscal tears, arthritic changes, anything along those lines. Number 9, the ankle strength scale is just for that, clients who have ankle or foot disorders. It allows us, again, to have the client perform a number of activities. We grade those activities. We get a point value, so it gives us a snapshot of the client's functional capability. And last one, number 10, the pain scale, which is a simple 1 to 10 pain scale that allows you each session or whatever period of time you want to just simply ask the client, Mr. Smith, on a 1 to 10 scale, with 10 being the worst pain you have, 1 being the least amount of pain, where are you with this activity or this exercise? Now, we go over all of these functional assessment scales in our AMES manual. I would urge you to make sure you get a copy. We go into depth, and we also talk about how you integrate these scales into your medical exercise training practice. Folks, I guarantee you, when you start utilizing these scales and you're communicating with doctors, therapists, and chiropractors, it will make it a lot easier to convey the progress the client is making or lack of progress the client is making, rather than trying to describe it verbally. They'll see it on the scale, and it's very clear and very evident. These are point value based. Point values go up, the client's getting better. There are a couple here that are inverted, in that the lower the point value, the better the client is. So these are essentially a means of taking a snapshot of the client's functional capacity. So with these scales, they become important as a simple means of determining the client's functional capability and their assessment procedures. Now, we talked earlier about some functional outcome measures. Whichever one of these functional outcome measures you decide to use based on the client's condition and their functional status, as well as the functional assessment scale, these now are allowing you to standardize your assessment process. And in the reporting of what you're finding with your clients and establishing baselines, doctors, therapists, chiropractors, everyone understands. So with that, as I said earlier, you can get copies of these manuals. I mentioned earlier, we have a special bundle, but I'm going to just spend a couple minutes on this Advanced Medical Exercise Specialist e-manual. This is the digital edition. It's 1,228 pages. It has protocols, assessment guidelines, sample documentation forms, everything that you need. I'd recommend that you do at least get the digital version. I think the digital version is like $129. Now, I'm not saying this just as a pitch, but folks, we're going to see over the next 20 years, the need for medical exercise training is going to grow. With that need growing, you're going to start dealing more with insurance carriers, and you're going to start dealing more direct communication with doctors, therapists, and chiropractors. We've put all the guidelines that you need into this manual, and you might want to take a look at getting it. So let me go back for 1 second here. Give me just a second. We're going to go back here. The screen got stuck. In the manual, we'll go over these functional assessment scales. In the manual also, we'll go over these functional outcome measures. Moving forward, if you are a medical exercise professional and you're focusing on managing medical conditions with exercise, regardless of the certification you're using, I highly recommend you understand and start utilizing these functional outcome measures to determine client progress, but also assess these to determine client baselines. With that, use these functional assessment scales. If you have to report the client's progress, use these to report progress in a systematically, easily understood means to the medical community, whether it's a doctor, therapist, chiropractor, occupational therapist, social worker, vocational rehabilitation counselor, as well as to the insurance carrier. And again, we mentioned the manual, and this is all sponsored by our Medical Exercise Specialist Network. Now, today is day 10 of our 30-day challenge to get your medical exercise training practice referral ready. On next Thursday, I believe that's May 29th at 9 p.m. Eastern time, we're going to have an evening session where we're going to go through everything we've learned from days 1 all the way to day 12. Now, next Monday, we're going to do day 11. Next Wednesday, we'll do day 12. And then next Thursday, which I believe is the 29th, we will talk about putting all these components together and how you actually will produce them. That's offered by our Medical Exercise Specialist Network. It is a free session. If you go over to crackingthecode.net, make sure you're registered. You will get an invite to that on next Thursday evening at 9 p.m. Eastern time. Now, last thing I'm going to close with is this. I know for a lot of you, you've worked in the fitness industry for many years. Some of you have worked in the medical community. You've worked in the physical therapy clinics, chiropractic clinics. Here's the one thing I recommend. Do a coaching session with us so we can help you transition from personal trainer to now medical exercise professional. There is a different lingo in the medical community. There's a different system process in the medical community that you need to understand. We're offering our Jumpstart coaching program. It's a 90-minute one-on-one coaching session. I'll do it. And instead of 90 minutes, it ended up usually being about 2 hours. You'll get that digital manual, the AMES manual we talked about. We also will get that cracking the code manual for those that want to seek insurance reimbursement. You'll also get our Essentials MET Forms kit. All the forms that you need, we'll give you the essential ones, and we'll personalize it with your logo, your contact information, as well as communication templates. These are templates that tell you how to talk to the doctor, therapist, or chiropractor. You also get access to our MES Jumpstart program through our new MES network that is launching in June, and it's only $299. Now, I guarantee you, folks, if you get one referral as a result of this from a medical provider, that means you're probably going to get another referral if you do good with that first one. Let's say you're at the lower end of medical exercise training fees. And we find the fees for medical exercise training are usually about 10 to 20% higher than personal training. But let's say you're at the low end, $50 per session. You get one referral from a doctor, therapist, or chiropractor, and you're charging $50 for that training session. And the client sees you twice a week for 4 weeks. If I'm not mistaken, that ends up being about $400. You've paid for the coaching, but more importantly, you're probably going to get other referrals, and that client is ongoing. So you might want to go over to crackingthecode.net to ask more questions. And with that, thank you for joining us this morning or this afternoon, depending upon where you are. Now, these Cracking the Code webinars, we're going to continue to do even after the 30-day challenge is over. And this is all about practice building tips. And let me explain why we're doing this. We started with the very first medical exercise or post-rehab certification back in 1994. And we've seen now a proliferation of these, which we think is good. But we're more concerned not about getting more certifications, but about helping you build a strong and profitable practice. Folks, you can have all the certifications in the world, but if you can't manage a client that's referred to you, if you can't develop a relationship with a medical provider, and if you can't document and communicate with the medical provider, your practice is never going to grow beyond just simply you running from pillar to post to get clients or keep clients. Please go over to crackingthecode.net to see our past webinars, and also join us on Monday. And on Monday, we'll be back with day 11. Then we'll do day 12 on Wednesday. And then Thursday night, we will have our session through our MES Masters program. So please, if you would, register. If you have a question for me, email me at drmike@postrehab.com. All the best, folks. Thank you for joining us.